My name is Leanne McIntyre. I'm the Assistant Vice President of Marketing, and under marketing there's a creative department, a marketing department, and then the liaisons department.
My name is Heather Ritchie. I am Creative and Brand Manager at the system level for Appalachian Regional Healthcare.
Previously, we used to use vendors that would come in and install TV screens, but we had limited control of what was on the TV screens. We evaluated all 14 hospitals and the clinic settings, and then we started purchasing the monitors, the software, and then coming up with a process of how we would organize this in-house. We started working with our IT department on how we could implement this structure. So far, it's been an extremely beneficial program that we've implemented within our system. Our creative team supplies all the creative, but that is pushed to one person dedicated on our creative team, and she houses and controls all of that. So we've had to look at a software that she could manage within her other duties. Sometimes it's nice to have our services across our system. Sometimes we compete against each other, so it was very important to know how to group certain hospitals to display the ads and when not to group, and how easily that was functioned. We also looked at software that we were able to grow. So we wanted something that was going to stay with us long term, that we didn't have to keep switching back and forth. As the first step, the first stage that we wanted to implement over 200. Our stage 2, we will probably use this program to implement wayfinding. Sometimes our clinics move. Sometimes as doctors leave, that same clinic may not go back in to the same location. So it really helps us in real time provide wayfinding to patients, that we don't have to wait on a vendor to come, take down a sign, produce a sign, install a sign. So it's really helping with our timeliness.
I would say 99% of our content is created internally. Being aware of where your audience is going to stand, where they're seeing it from, so that it's legible.
We have fully installed in the last year, and the biggest reward for us with NoviSign is that we hear our patients and our family members and our neighbors come up to us and say, "Hey, I saw that monitor while we were in the ER waiting on our loved one to get seen. I saw your CT surgeon. I didn't know he was back." So we know it's working because of word of mouth. The biggest improvement that we've seen by using NoviSign is probably just the awareness that we've created internally within our workforce and our current patient.
We absolutely recommend NoviSign software. We're just really looking forward what we can do in the future with it as well.